Assalamualaikum warahmatullahi wabarakatuh. My name is Rati Puraningrum. I'm from Biology Education A. I will explain about my story about women with polydactyly disease. So, polydactyly is one of the most common birth defect and affect about 1 in 1,000 babies. In this condition, babies are born with more than 5 fingers. Polydactyly can occur in one or both hand or feet. The term polydactyly comes from Greek, namely polis, which means many, and dactylos, which means fingers. This congenital disorder can run in families. So, a child is at risk of experiencing polydactyly if the parent also have this disorder. Recognize the cause polydactyly. The cause polydactyly can be divided into two, namely genetic and non-genetic cause. The following is the explanation. Another genetic disorder that can cause polydactyly is usually a syndrome or a collection symptoms that not only cause abnormalities in the number of fingers, but also abnormalities in other organs such as the heart and kidneys. Down syndrome is a syndrome that is closely related to polydactyly. And non-genetic cause, this cause is not related to heredity but is related to health, the condition of the mother and baby while in the womb. There are several factors that can put a child at a higher risk of experiencing polydactyly, and namely children of mother with diabetes, children of mother with upper and respiratory tract infection in the first 3 months of pregnancy, children of mother who have history of epilepsy, and children with birth weight low, the child exposed to thalidomide embryos. Types of polydactyly you need to recognize. There are 3 types of polydactyly based on the area of additional finger growth, namely preaxial polydactyly, namely the growth of additional fingers on the other side of the thumb or big toe. Postaxial polydactyly, namely the growth of additional finger outside the side of the little finger on the hand or foot. And central polydactyly, namely grow extra finger in the middle of the finger or two. This condition is the rarest. The condition of the extra finger in people with polydactyly is different. Additional finger and perfectly shaped like other fingers may also be jointless or may even consist only of skin and soft tissue. And handling of polydactyly. Polydactyly is a form of birth. The doctor will examine the position and additional finger components to determine the type of polydactyly and estimate what the type of treatment is appropriate. The doctor will also check the condition of other organs to determine whether polydactyly is part of the particular syndrome or not. So, polydactyly can actually be left to adulthood without causing health problems, especially in cases that do not involve abnormalities in other organs. However, most polydactyly needs to be treated before the child is 3 years old, and this fast handling is needed so that this child does not have difficult doing activities that involve the fingers, such as writing or typing, and can wear shoes that fit the size of their feet. And the handling of polydactyly is divided into two, namely vascular clip. It works if the extra finger consists only of soft tissue. The doctor may uh, place a vascular clip at the base of this extra finger, so like the clip on the umbilical cord. This clip will stop the flow of blood causing of tissue to die. Once dry, the extra finger will fall off the normal finger. And operation. Polydactyly surgery is surgical technique to remove an extra finger that is shaped like a real finger, not just a soft tissue. So polydactyly surgery is usually a simple operation and does not require hospitalization. However, this returns to the level of complexity of the operation. If the extra finger is intact, the look exactly like a regular finger, the complexity of the operation may be higher. This is to ensure that after operation, the hand or foot can function properly. A hand or foot that has been operation on may require a case of spleen for up to several weeks, and after the surgical wound has healed, the doctor may also recommend physical therapy or occupational therapy, especially if polydactyly occur the hands. The goals of the physical therapy and occupational therapy is for the limb to recover quickly and function as usual. This treatment cannot only be applied to children, but also to adults too. If you feel uncomfortable or your activities are disturbed due to polydactyly, consult a doctor to get the right treatment. In children, polydactyly can be treated by a pediatric or orthopedic specialist. So I think enough about my story, and I'm sorry for my mistake. And the last, wassalamualaikum warahmatullahi wabarakatuh.